In 3, 2, 1.
John, are we live?
We're live, sir.
What's going on, buddy?
Not too much, my man. How are you?
I'm good. A little bit exhausted from 5 days in Cabo San Lucas, but I can't complain. A shade tanner than usual.
Yes, you are. And that's saying something.
I know. I usually start with a base tan, and it just gets tanner as it goes.
Exactly.
There's people at the resort were like, "You don't burn." I'm like, "Yeah, I kind of start with a tan."
Yeah, you're like halfway through the, down the path already.
Yeah.
I get out there, my Irish white ass skin,
burn
like crazy.
There was a guy probably 10 shades whiter than you at the pool. And the first day he got there, he looked pretty white, and the second day he looked like your Blackhawks flag. He was pretty,
that's funny.
Pretty burned up. What's going on, buddy? Got any shout-outs? Because I'm really excited about today's show. We've been chatting with these guys for about a half hour now before the show started, and there's so much I want to get to.
I agree. I concur. Yes, I do. I want to shout out. I'm going to adjust my volume first. I'm going to shout out to the Chicago Police Department because they did an investigation and they got made to look foolish by the Cook County State's Attorney. And I think they have a thankless job, and they were badly mistreated by what has happened with the Smollett thing. And I think that they deserve better, and I shout out to them because it's just not fair what's going on. So that's it.
Well, I didn't have a shout-out, but I wasn't going to be able to one-up your CPD shout-out.
Well,
lost
it,
there.
Man.
No. Yeah, it's crazy. When I was on the flight coming back yesterday, the lady behind me, she had to stop in Chicago when she was going, and she's like, "Hey, did you see the article?" And I hadn't seen it yet.
Well, you were drinking and partying.
Yeah, so I looked at it yesterday. I was like, "Oh boy, that's the attorney in me." There's a lot to talk about when it comes to that. But
I didn't even think about that.
Yeah, that's it's a crazy precedent that happened, but
it's sad.
Yeah.
It was a sad day. So I'll let it go.
I will jump into our guests because
Yeah,
I'm pretty psyched about this one. I'm psyched about all of them, but this one I'm really psyched about. Daniel Carcillo, who I'm guessing everybody who's watching knows. We have guests on from time to time, and people don't know their names.
Yes.
He played in the NHL from 2003 to 2015. If I butcher this, let me know, Daniel. He's won the Stanley Cup twice with our Chicago Blackhawks.
Boom.
He had a kick butt nickname, the Car Bomb. And we'll chat about that a little bit and his hockey career.
Yep.
One really cool thing he's doing is the Chapter 5 Foundation, which I'm going to let him explain what it is because I definitely don't want to butcher this because it's a definite passion piece for him. And
it's very important.
Advise everybody to go to chapter5foundation.com, watch the video. It's one of the most powerful videos you'll ever see, and it tells the story really well. But thanks for coming on. I'll let you tell everybody what Chapter 5 is.
Thanks for having me, guys. Appreciate the invite. So Chapter 5, in its essence, is a transition program that helps athletes transition into life after the game. Now, what it's kind of morphed into the last 3.5 years of operating it, the answer isn't to get somebody a job or connect them with a business professional. We have to assess how you're doing as a human being. The sad reality of it right now is that guys coming out of collision sports are having mental health complications that they weren't predisposed to because of the repetitive head trauma that they've sustained. So the first thing is to really look at the individual, figure out their needs, and if they do need that help, if they do need that recovery, if they need help to get off of substances, then we look at that first. If you're not healthy enough, if your cup isn't full, you're not going to be able to keep a job. Right, you're not going to be able to have a great marriage, like what happened in my experience. Which all of those things were tested, and I had to look in the mirror, assess the state of my brain, and go get help. And after I did that, then things started to turn around in my life. So that's what we look at first. And there's some self-discovery. Who are you away from the sport? Some education for the family members, wives, brothers, sisters, parents. Derek Armstrong, I think, said it best with athletes. You die two deaths. So you die when you retire, and you die when you die.
Yeah.
And it's very, very true. It's unless you work in that community, you really have to repurpose your life and figure out who you are away from the sport, away from your ego. There wasn't 20,000 people cheering me on the way here to do this podcast, or every morning when I wake up, right? So it's a bit of a different aspect, and you're not in a team. You're not in that team community, and so just trying to really create a community to help catch guys and just to help them move forward through it's an informal process, because in my experience I didn't do too well with the suits. Trying to help me through it. I like to listen to people with lived experience and somebody's that's kind of gone through the wall, so to speak.
And you touched on it before we came on air, and you said, it's different for every single person. So, obviously the going away from a sport at a very high level where you have, like you said, 20,000 people cheering for you, to that not being there might be similar for each athlete, but there's so much that goes into what each athlete's gone through, if they have a wife, if they have kids. And it seems like, until I heard about your Chapter 5 Foundation and you coming on the show, there's not that many outlets for people who are getting away from a sport. Do you find that it's kind of just a missing piece?
Yeah. I don't know if there's enough done on the mental health or brain health aspect of this all. And I would like to see that. I would like to see that changed. I'd like to see whether it's the union or the team specifically take more of an active role in helping guys prepare and helping their family members prepare. And we don't pay health insurance. I'm from Canada.
Yeah.
I've never been introduced to this healthcare system. I'm now paying over $2,400 a month.
Wow.
And a lot of my stuff gets denied because it's from the NHLPA and they say I have a pre-existing condition. So just understanding that in itself is really stressful. And I struggled with it a lot. So in talking to independent insurance experts and going through the learning process, now I have that knowledge that I can help guys decipher what these plans are and what to say so that you do get covered. I'm a grinder.
Yeah.
It's not from hockey. I have no bottom teeth because I grind.
Yeah.
That's who I am, so.
Do you feel as though, obviously, people should have started this sort of education way earlier? I mean, you got out of the sport, you grinded your way into getting this education and then opening a foundation. But it feels like they should go back way sooner, way before college or even the NHL.
Yeah. So the NHL is a little bit different in its development. And when I say that self-discovery is a big piece to transition, it is, because specifically for hockey players, I moved away at 16.
Very young.
Yeah, I got drafted to the NHL at 18. I was still in high school.
Yeah.
And then when I was doing my own laundry and getting a paycheck, I was 19 in a town I didn't know anyone in, and you're cooking your own meals and doing your own laundry, and you grow up really quick. You miss that self-discovery phase. At 16, I'm on a bus to Sault Ste. Marie one way, playing a game, 7-hour bus ride, 7 hours on the way back, and then I go to school.
Yeah.
So I wasn't going to those house parties. I didn't have real relationships away from the rink, and guys don't have a firm grasp on who they are.
Yeah.
And so that's one of the big reasons why I think it's a little bit difficult to move into something post-career, and you work so hard, you are so singularly focused on doing one thing, and that is playing hockey. And what goes into that? Diet, who you can hang out with, your mental focus, and really just showing up at the rink as your best self. In my opinion, if you provide good education and proper help for mental health issues, athletes will inherently be more singularly focused on playing the sport. So owners and GMs and coaches will get an optimized athlete rather than them worrying about the anxiety of schoolwork per se or what's going on at home. If they have an outlet to talk about that, then I think that's a good thing, right? I think it's a good thing to be able to leave that where it should be left, which is with an independent professional person that you could unload that onto.
Yeah, and I think we take for granted as fans of sports what you had just said about from your very youthful age, you didn't get a chance to grow up. I tell everybody, I say, I don't think people really mature mentally till they're 25 or 30. They go through that transition process, but you're thrown into such a high stress situation. And then at some point, you have to almost self-deal with it, like you said, because there's not an outlet. And I think we all take that for granted. So it's great to watch you guys now bring light to that, because selfishly, I don't think fans think about that.
So transition's a human issue, just like concussion is a human issue, right? We all deal with mental health issues.
Yeah, everybody
Whether
does.
we want to believe it or not. I don't believe that it's 1 in 5. It might be 1 in 5 for a neurological imbalance that you're born with, which is mental illness, which I think is different than mental health complications. But I know that we deal with it. So the question is now, is how do you deal with it? How do you get that education? Who do you turn to?
Right.
And it's something that I would like to see change. Now, the reality is that everybody's looking at who? Athletes.
Right.
That's where they get their information from, and from social media platforms. So for me, obviously there's some programs that I'd like to see implemented with kids so that when they do get to that stage, they already know this stuff. It's already ingrained in them. But for the guys that have missed out on it and missed out on this type of education, it needs to be provided to them. And if it's not provided to them, then we're going to see guys keep falling through the cracks and, to be very blunt, dying.
Yeah. And obviously you've dealt with concussions multiple times over and a lot of head trauma. Do you feel as though it got exponentially worse? And because we talked off air, and we can start chatting about it now if you'd like, for people who are listening. You've done a very good job, it sounds like, after you've had a lot of concussions, now getting yourself back to that kind of, what did you call it?
So there's your normal, and then there's your new normal after brain damage.
Right. Do you feel like if you had started doing that at your first concussion, it would have made a gigantic difference for your career, and obviously your second career after you retired?
I believe so. So, for example, I went to treatment in 2013 to the Carrick Institute. I saw the godfather of functional neurology. I saw Ted Carrick and was lucky enough to catch him the week that he was there. And after that treatment, now I wasn't symptomatic, and Steve Monador actually told me about going there when he came back, begging me for 2 or 3 weeks. Gotta go, come with me. I'm like, I'm not having any symptoms. And that's the scary thing. When you're stimulated and you're in your life and doing the one thing that you know how to do, and you think you're doing it at a optimized and healthy level, you don't think you're symptomatic. And looking back on it now, I can see my behavior, and I was very symptomatic. Seeing Steve come back from that week of the Carrick Institute and fighting him, and then seeing him in the gym and seeing that his autonomic system was optimized, and his vestibular system, his balance, things changed. His speech changed. The color in his face changed. His eyes changed. He was looking me in the eye. So, okay, I'll go. I packed my bags and I went. After I came back from the Carrick Institute in 2013, I won my first Stanley Cup that lockout year, and I believe it extended my career for 3 years. I also had a concussion that year, and then I had my 7th before I retired. And I honestly, I don't say this to be dramatic. I don't know if I'd be here if I didn't go in 2013, and then I got my 6th and 7th concussion without that treatment. When I went this past April to the Plasticity Brain Center to see Matt Antonucci, they told me that I was, they didn't tell me in 2013, but they told me that I was their worst TBI case that they'd seen to date in 2013.
Wow.
But they optimized me. They got me back to a level of, to be honest, I hadn't had treatment since I was 16. I started taking some pretty bad hits from the OHL on. I think they cut my hand-eye coordination down by 3 milliseconds, which is huge.
Huge difference.
For an athlete, You're looking for that extra like 3 to 4 to 5%. It's huge. Processing speed, being able to process what's coming at you quicker, peripheral spatial awareness, being able to see the hits even at the last second, tensing up your neck muscles, inherently protecting yourself. That's the only thing that will protect guys now is a better functional baseline and increasing that spatial awareness. All the stuff about helmets and supplements is all bullshit. There's no helmet that protects from your brain smashing around inside of a rigid skull because of the G-forces of a hit to the body. That force travels up your spine into your brainstem, and it does rattle your brain.
And it's incredible what you said, because it doesn't make any sense for me for people not to want their athletes optimized like that. Before we came on air, he was showing me how good his peripheral vision is, and it's better than mine. I mean, you've had a lot more concussions than maybe I've had one. And I boxed a little bit. I've been in a couple car accidents. I think the doctor, when he comes on, will tell me I've had probably more concussions than I think I've had. But your peripheral vision is so good, and you've trained it, and it doesn't make any sense to me for teams and leagues not to want the best athletes.
So I say that this campaign, whatever you want to call what I'm doing on social media, it's a 5-year plan. We're almost at the end of year 1, and I just want people to understand what proper understanding, diagnosis, and care of a brain injury looks like. And I say that this works on 3 levels. Number 1, we want to treat the human being properly, first and foremost. It shouldn't be called sports medicine anymore. These doctors are all conflicted. They all have major relationships to collision sports, yet they're still making our return to play protocol for sport. Doesn't make any sense to me, and it's bias. And based off of my experience and the lack of treatment that I got, I don't agree with it. So I want to see that changed. But there's steps that can be taken that will help everybody. So number 1, the human being gets proper diagnosis. Number 1, understanding of the risks of doing their job, repetitive head trauma, and proper diagnosis and care. So he's not leaving the game with a chemical imbalance, and he's not in a situation like Rick Rippon, who had clinical depression. That's a neurological imbalance. You add concussion, repetitive head trauma on top of that, and a chemical imbalance, that's clinical depression on steroids. He committed suicide. When I say the NHL is killing people, I'm not saying that lightly.
Yeah.
You know, Bob Probert, look at what happened to him. Heart attack on a really humid day. Why? Could his autonomic system have been off? His heart rate? His blood pressure? His blood vessel diameter? Maybe.
Yeah.
I think so. So, number 2, it works for the fans. They get to see an optimized athlete, better processing speed, less accidental hits. Why are we seeing all these accidental hits?
You were saying they couldn't see it coming.
They can't see it coming. Millennials are here all day. Now we're growing up. There's a video screen here. Our vision is so confined now with kids coming up. So expanding that. You optimize these athletes, okay, and they don't have to leave the game with, again, a chemical imbalance. And then number 3, they're less susceptible to injury. So who wins with that? The owners and the GMs.
Sure.
So everybody wins. The human being, the fans, and the owners and GMs. Now, I say this, I'm not just wasting my breath. I say this because it's going to open some eyes, because the NHL will not implement this because they're embroiled in some pretty deep water as far as litigation. Now, March 20th came and went, and we still haven't heard from the NHL about if they're going to accept the percentage of enrollment in the concussion settlement. It's a big deal.
Yeah, huge deal.
You know, because that's going to determine what they're going to do moving forward. Right now, they are not going to change their protocol. They're still going to sell the game on violence, hate, and rivalries. And the protocol's impact. That's it. Impact application test on an iPad. That's it.
It seems like players should be getting behind. I feel like if you obviously have a very large voice in this and you can tell the story from your own experience, but I'm sure players who are out there playing right now need to get behind this too.
It's tough. You don't want to look at it. You just, I mean, tell a 30-year-old man, like when I retired, somewhat financially secure, with a kid who's 7 months old, to stand in front of a doctor, get sober enough to assess the state of your brain after 12 years of professional hockey. It's not easy.
Do you think it's just the inherent toughness in you
Yeah,
guys just don't want to admit
and you don't want the education. 2013, I wasn't asking questions to Dr. Carrick like I am now. I just wanted to do it, get out of there. Oh, now you're good. Okay, thanks, doc. That's the reality when you're so inherently focused on just having your body prepared and your mind as best you can on doing one thing, which is literally, like, my job wasn't very hard, but it took all of my focus to be able to, I had mantras in my head to be able to stop myself from snapping.
Yeah.
You know, like there's things that I had to worry about that I'm sure other guys didn't. But for me, I still didn't want that information. And I know a lot of guys don't want that information. I know a lot of guys in the NHLPA that will not sign off on higher suspensions and taking more money for head hits. Guys care about money.
Sure.
Nobody knows about escrow. There's a lot that has to happen, you know, like as far as NHL players understanding the inherent risks of repetitive head trauma, brain injuries, subconcussive hits, whatever you want to call them. Forget about CTE. Forget about that word. Brain injury and brain damage lead to neurological degenerative diseases. That's all you need to know.
Yeah.
Brain injury and brain damage lead to neurological degenerative diseases. Forget about CTE.
And without proper treatment and training, like you've been telling us, you can't go back to that new normal. It's
very hard to get there.
difficult
I've spent hundreds of thousands of dollars. I don't say this to be dramatic, man. I'm honestly thinking of selling my Stanley Cup rings to continue to be able to do treatments, to continue to be able to support my family. I did an article just about like what I've lost as far as personally, financially, by doing what I'm doing, what's been kind of taken from me. And I can't sit here and not expect that was going to happen, but that's a reality. And so moving forward, I have to figure out ways that when I told you your cup has to be full to be able to do like the advocacy work, to be able to just be able to get up and be present for my family. It's a lot. It's a lot of money that I have to spend. And so I get mad, right? Like some days, man, I'm frustrated. I'm angry because how can I be in this position? I'm 34 years old.
Yeah.
2 Stanley Cups. And why is all my money going towards treatment, going towards being able to get up, not having suicidal ideation and depression and anxiety just take over my life?
Yeah,
you know?
It's ludicrous that with how much money is in these sports and how hard you guys have worked for since you started playing way before 16. I'm sure. Mm-hmm. When did you start playing?
4 years old.
4 years old.
Playing
for
and
30
hitting,
years,
yeah.
Playing and hitting. That something isn't done sooner so that you don't have to worry about that in your 30s. And 34, you're young. I mean, the average life expectancy, doctor, and we're going to get to him in a second, 80-ish now for a male? 79, 80.
It's a parabolic curve, and because of what I said about brain injury, brain damage, like everybody's kind of running with, oh my gosh, I'm going to get CT. Oh, I had a concussion. Doc, am I going to get CT? You've had brain injury, right? And you have brain damage. Now, we know a stat, like three or more traumatic brain injuries, you're 80% more susceptible to early onset dementia, Alzheimer's, and Parkinsonism. Like, we know that stat. So just take that stat. You know, they could have told us that. That's my thing, man. I started in 2006. Dr. Carrick's been doing this since 2003. There's a doctor at the University of Cincinnati, and Joe Clark, who's been doing, who's cut down the NCAA football concussion rate by 80% since 2010. Like, why are these people out there doing really good things? How does a league that's worth $4.8 billion not implementing any of this stuff and protecting their employees?
It's ludicrous.
You know,
it's insane.
It's tough. It's tough, you know.
John had a question. John, do you want to ask it? Because I wrote it and it was long and my eyesight is pretty poor too.
Yeah. So you made mention a few minutes ago as far as some of your behavior. As you look back now, some of your behavior back then showed you that you were symptomatic. And I'm just curious what it is that you were able to look at now, looking back, that made you think that?
Oh, man. My substance abuse, my anxiety, not being able to sleep before games, insomnia before some nights, which leads to, again, things that you're not predisposed to, that you don't understand, that you haven't been educated on. Well, what's the easy route? Is to numb stuff out, right? And we're overprescribed and undereducated in that regard as well. My impulse control issues, my isolation issues, oversleeping, undersleeping, not wanting to communicate with any of my family members or friends when stuff got bad. Like, everybody kind of knew when things were, going bad with me. I would isolate, But I was just like, I like to be alone, and I do. I love my alone time, But
Sure.
Those are what I just listed are telltale signs.
Yeah. I mean, and that's a list.
Yeah, I mean, my speech was really slurred. Just recently, I can feel it kind of reverting back. Like, it's been a year since.
Yeah, you sound great.
Yeah, but in my mind, I can hear it. I know when things are starting to slip back and when I need to go back for treatment. This is something that I believe I have to work on to keep it. And that's why I think a lot of people don't know about functional neurology and its work.
Yeah.
And it's not as easy as opening up a pill bottle or taking a supplement, but in working for something, and you also know that it's really rewarding and you get results.
Sure. But,
which I have gotten.
And none of it's really covered by the NHL insurance for retired players.
No, I get a letter back from the organization saying it's unreasonable treatment.
That's unbelievable to me.
And I plan on taking a picture and showing everybody all of my claims that have been denied, not only by the PA but the Blackhawks, because I have 2 workers' comp cases open with the Blackhawks. My last 2 concussions were with the Blackhawks, and full disclosure, they're trying to settle it for $10,000 each. That's how much they think a brain injury is worth.
It's unbelievable to me that with as much information and data as you said since 2003 has been compiled, that it's unreasonable to cover these things for athletes that have played for fans and made these teams and the NHL billions upon billions of dollars every single year. To me, I think it's insanity.
It's criminal.
That's why they're
in litigation.
What's the NHL's protocol now when somebody gets a concussion? So if somebody gets hit hard and they have a concussion, and we're going to talk with the doctor about this and how MRIs don't typically pick up all the concussions because we spoke off air about it. I'm fascinated about that. What's the protocol today? If you got hit hard or you hit somebody hard, what's the protocol? How does it work?
I can't speak to what it is today, even though I know what it is. In 2015, for me, it was talking to, I wish I was talking to somebody with the knowledge of George. Literally, it was the orthopedic surgeon asking me questions, looking at my eyes, and making a decision whether I was fit to play or not. And, you could talk to George about it. It's tough to trick them, but should an orthopedic surgeon be doing should he be looking at my head?
No.
Should a strength and conditioning coach and an athletic therapist be looking at my head?
No, especially because you're inherently tough too. So you're not.
So you're going to lie, right? And there's ways. Number one, so even for the impact test, so we do a functional baseline in the NHL with impact applications. There's been 0 research that they've ever put out on impact applications. That's because it only works 46% of the time.
Wow.
It can be gamed. And we game it. You better believe we game it. Number one, we game it. You might look at me and, well, you're stupid and you put yourself in this situation. Well, you don't know what you don't know. If you don't understand the risks and you're not being educated on them by the league that you are working for, how do you know how dangerous it is to game a computer system like that. Right. That's going to identify if you are okay to return to play. It just shouldn't be done, right? Yeah. And so we talk about like functional baselines and multimodal approach, checking 5-6 different systems if you're UPMC, to really identify if somebody is hurt. If they still have that chemical imbalance on their brain, if their processing speed is slowed down, if their hand-eye coordination is off, their vestibular system, their balance is off. All really important things for hockey players and human beings in general.
Well, I'm going to bring on the doctor for a second so we can do ask him some questions in a roundtable, because I'm fascinated to hear about how he got involved in this. Dr. George Michaelopoulos is a chiropractic neurologist with the Neurologic Wellness Institute. He's been a chiropractic neurologist for 29 years. I'm going to let him explain what that is, too, because just like with his foundation, I don't want to butcher that. Okay. It's a medical term of art, so I'll let you go ahead and explain that.
So, I've been a chiropractor for 29 years, but a functional neurologist, actually a chiropractic neurologist for about 6 years. I started this about 10 years ago. And basically, there's 12 chiropractic neurologists in the state of Illinois, and there's 3 that are actually fellowship trained under Dr. Carrick in Illinois that all work at the Neurological Wellness Institute, which have another additional 3 years of training for concussion, rehab, brain injuries. And so basically what functional neurology is it's simply a term. It's not like I'm a chiropractic neurologist, but we practice functional neurology, which is a term that we use to describe evidence-based procedures in vestibular rehab, visual rehab, proprioceptive rehab, with a huge understanding of neuroanatomy and how all these pathways work. And we want to kind of strengthen these pathways to increase and enhance human function and human performance.
For athletes and non-athletes, because
for everybody.
We were speaking off air, and for anybody who's watching and saying, well, I don't play any combat sports or any contact sports, you could take a guy like me, and actually I'm going to come see you after this because it's fascinating to me that you could take somebody like me and then optimize all the rest of the things that I'm probably missing that Daniel was talking about.
Yeah, I mean, I know that, we talked about a whole bunch of things off air, but a lot of times people don't even know that they have a concussion, okay, or they get these subconcussive hits and say, I feel a little bit off, and these are the problems where they say, I've never had a concussion, or somebody comes in and they've been suffering for 2 years post concussion or 3 years, and they've gone through the gamut of all these therapies, and they come into us and say, well, I got this one concussion. Well, what do you do for a living? I play soccer. And so these soccer balls are like bricks. Okay, they're not soft Nerf balls, and they're coming at 40, 50 miles an hour. You're hitting it with your head, and you're getting all these subconcussive hits. If you're not knocked unconscious and say, hey, look, I that's the one concussion I remember that I got. Well, you probably had 50 or 60 smaller ones before that just keep accumulating, and the big one was the straw that broke the camel's back type of thing that put you over the top. So basically what we do is we examine brain functionality. We know kind of where normal is, and we know where abnormal is, and we need to when people come in, we'll say, okay, this is where you are. We know that these by looking at what Daniel was talking about with vision therapy or looking at the eyes, this is the window to the brain. You cannot make these eye movements without some part of the brain lighting up, whether it's the cortex or the frontal lobe or the parietal lobe or the temporal lobe, or even the brainstem. And the brainstem is where that's where life is. That's where your autonomic nervous system. That's where your blood pressure is. That's where your heart rate is. We get kids that come in and they get concussion. All of a sudden, they're sitting in that chair and their heart rate's 130, 140 beats a minute at rest, and they have no idea why they're tired, okay, or they're sleeping too much or eating too much, or I got headaches. I can't I'm tired. I don't want to go. I can't focus. I can't concentrate. I'm depressed. I've got anxiety. All these things just keep adding and adding and adding. And when you do, the problem that I see with a lot of these concussion rehab programs is it's an algorithm for them, and they go, okay, just like what I'm talking about. But it's like week 1 you're going to do this, week 2 you're going to do this, week 3 you're going to do this, and then after that you're done. But it's not one size fits all. There's so many different. Every concussion is totally different, and it's unique to every person, and it's got to be customized to make sure that we drive the pathways that need to be driven, and we have to find a way to do that, and that's what we do. That's what we're really good at.
One of 2 points. Number 1, IndyCar Series uses the iPass to track eye movement. Can't cheat it.
Yeah.
Can't be gamed. That could be something that could be implemented pretty easily. And then they actually attach that functional baseline to accelerometers in the driver's ears. If they get into a situation where they have a hit, they hit a wall, the accelerometers read the G-forces, and we know a minimum amount of G-forces that may cause injury, and it reads that back to the computer system. So this driver's pulled, and he's put through protocol right away. And not only that, they have this information pre-injury, right? So they try to get him back and optimized back to that sort of old normal that we call it, And I'm blanking on my other point, but it'll probably come back. Oh, the Carrick Institute. The first time I went there, they say it is individualized, and they say that we treat not the person with a condition, which is concussion or brain injury. We treat the condition that we find in the person. Mm-hmm. So they look at each individual and make you a personalized program accordingly, what they see in me, what they're going to see in you. And he helped, to his point about not knowing, my neighbor fell off of a 12-foot roof. And he was describing all of the post-concussive symptoms to me. I'm like, man, you have exactly what I have, or what I have. I still have it, just to a lesser degree. He fought me, again, just like I fought Steve. Talking to people about brain health is scary, particularly men, and they will not seek treatment until their quality of life gets bad enough. That's right. The reality. It's just like talking to a drug addict. And I've been addicted to opiates, so I know both sides of it. They will not seek help until their quality of life gets bad enough. And that's the sad reality, and that's why I push so hard with education and awareness to recognize those signs and symptoms, to be able to move into proper diagnosis and care. Proper diagnosis and care. That's from the Carrick Institute.
And it's crazy to me that IndyCar is doing it, because IndyCar is big. I race cars, but they're not NHL, NFL big. They're at a. I don't think they have that sort of money and that sort of.
I don't think so. I know that the NHL just moved into 5th place in sport generating revenue behind the Premier League. So congratulations to them.
Yeah, it's crazy that IndyCar is doing something that in yours can't be gamed, but some other folks aren't. And I agree with you. I'm sure professional athletes are inherently, again, much, much tougher, and guys don't ever want to admit they have something wrong with them until it's, like you said, too late. And my guess is that even if the treatment's individual, doctor, as 2 or 3 or 4 concussions go by, does the post-concussion syndrome get that much more difficult to treat?
Well, so some people don't believe in post-concussion syndrome, okay? But there's a diagnosis code. It's in the DSM book that says there is something there's other neurologists out there that say, look, there's no such thing, but the more that you accumulate these micro traumas that aren't the first one you get, let's say it's subconcussive, you don't even know you have it. What's going to happen is your brain will compensate. Just like if you twist your ankle and you go, oh, that hurts a little bit, in 2 or 3 weeks it'll get better on its own. But what you've done now is you've compensated, and the same thing happens with a lot of these subconcussive hits. You will compensate, and the way you'll compensate is your eyes, okay, are kind of connected to your neck muscles and your brainstem. So what'll happen is your neck will get tight, and you don't even realize it. Say, I've been playing soccer and I or playing hockey, got cross-checked from behind, really didn't get bad. And what will happen is you start to keep compensating. And so it's the same thing as you limping with your ankle, your brain's limping until your buddy just horses around with you and goes, oh my goodness, these huge symptoms came out of nowhere. I was just horsing around with a buddy of mine. But it's almost like the scales tip, and you just go over the top. And I know we were talking about CTE, but CTE. The scary thing with CTE is you can have symptoms of a concussion, okay, and think, oh my goodness, I'm going to get CTE, or you can have no symptoms. Okay, you can have all these subconcussive hits and continue to build these massive proteins in your brain that can't get cleared out, and you'll say that just came out of nowhere. Right, so
brain injury, like you can agree, brain injury symptoms are the same as CTE symptoms.
Yeah, absolutely, yeah.
Like that's and the misnomer out there is that study. The media plays such a big role in this. They highlighted the results. They didn't highlight all of the biases. Like there's some glaring things that they didn't do. Like, for example, they took 111 guys who were very symptomatic. Mm-hmm. Usually then you take 111 guys who aren't symptomatic.
Sure.
And then you publish, right? There's no African Americans in the study. 70% of the NFL is black.
Yeah.
There's a lot of really weird things that came out of BU, but you have to also understand, if you look at what they're trying to sell, they're selling CTE, right? They're also trying to cure a neurological degenerative disease. They're also killing a lot of guys. Todd Ewan is one of them. He committed suicide specifically because of that narrative, and specifically because he thought he was going to die of CTE. The Lancet medical journal, they did wrote up a big paper with a bunch of the doctors who sit on the International Consensus Group and the Head, Neck, and Spine Committee, and addressing that very thing about the hysteria caused by CTE. So CTE symptoms are the same as brain injury symptoms, and if you move forward with brain injury symptoms, there's treatment for brain injury. And there's people out there that go look at Dale Earnhardt Jr., get his book. He wrote down notes, and he actually got treated by a UPMC, which that worked for him, and it's not a one shoe fits all kind of deal, again, because it's so individualized. Sometimes the reality is, and I'll just put this out there, like chiropractic neurology or functional neurology might not work for you. So what else can you do? Like in my experience, like cranial sacral was great in like decompressing my head pressure and migraines, and even my autonomic system. If you look at what cranial sacral can do, it's amazing. Moxa acupuncture was huge for my neck and my spine. I had so many depressions. I couldn't feel my spine going into my head. There was so much inflammation. So Linda Ho in Beverly Hills was amazing for that. Self-deprivation tanks, unbelievable. I love them. There's so many things we can do.
It's crazy to me that it took so long for you to do those things, and you're so well educated on all these different treatments now. I go back to it. It's crazy to me that this stuff isn't just introduced so much sooner, because both of you are talking about so many different symptoms that can pop up where your neck hurts. And yeah, you just think to yourself, well, I lifted weights yesterday and I shrugged a little stupid and now my neck hurts. But it could be going back to something that's so much more severe that I just can't believe there's not an implemented treatment system, or at least an education system for you guys. Because what you touched on, if you had known this stuff way before, whether you were tough or not, you would have at least been thinking it's probably a good idea for me to do some of it.
You plant that seed, just like the seed that was planted about what opiates are, it's synthetic heroin, and how to get off of it. It's always there. Right. So you always know you shouldn't be doing it. If you get that education and that seed is planted early, and then each year, each month, there's new studies coming out, and you keep feeding them the information, you keep watering the seed, the plant grows, and it's there. And then you can't you just can't ignore it.
Well, then you have, you now have a family. You start to think to yourself, well, I have to be good for another 40, 50, 60 years. I got kids. I got a wife now. So I think if this education platform gets introduced so much sooner, then like you said, the seed's planted and people will at least start to consider it. It's truly astonishing that it's not a part of it in the sports.
I think the scariest thing, honestly, the scariest thing that I think about is not dying, is not getting early onset dementia or Alzheimer's, Parkinson's. It's if that happens at some point in my life, I do not want my wife and kids to see me go through that. That's the one main thing that pops in my head that I try to push out. That's my only concern, And then if I do get that, I'm going to document it. You better believe I'm going to be on camera every day documenting it so people know what this is. I do a lot of podcasts. I do a lot of videos because I want all of this documented,
And kudos to you for doing that. I mean, if more athletes and while they're playing or after they're done playing start to do this, especially because you guys have a big following. People love you guys and they followed you throughout your career. If more athletes did something like this, people will hopefully be forced into doing something.
Yeah, and that's the goal, right? The ultimate goal is to work with professionals. I'm not a doctor. I don't have years on my life to go back to school. I'm just not going to do that. So you have to find like-minded people that. And I have in Dr. George and a lot of the doctors in the Carrick Institute that not only have saved my life, because it has. Those 2 visits most definitely have saved my life. And now it's about making sure people recognize signs and symptoms and that there's awareness. There's people like him in Chicago right now that if you don't need your life saved, guess what? He can optimize you.
Yeah.
Right?
No.
Optimize your performance, even if it's not from a sport perspective, and that's why you're thinking of going to see him, right?
I would love to go see you because I feel like you said, you have your brain and it's fragile. We spoke off about how fragile it is. Why not be optimizing everything I do every day? Right. Whether it be work where I'm doing a triathlon in 2 months, why not make sure that I'm optimized? You have a lot of shout outs, by the way. You have Phil says Dr. George rocks. You have Kathy Pinto that says Dr. George rocks. You got Eric William that says Dr. George is the man in caps. Love this. John, I think you had a question too. Before
yeah, actually, I do.
And I just want to interject before I forget this. But if you want to learn about concussions and signs and symptoms and proper understanding and diagnosis and care, organizations stop going to Piroth. Don't have her come and do her presentation. Okay. Have Dr. George do it. Call Dr. George, and I can go with you, or you can go on your own. Have somebody that is actually treating individuals properly and diagnosing and caring for people. Are you a season ticket holder for the Blackhawks?
Well, next year.
Okay. Well, don't even do that, because in my mind, relationship psychology 101, our relationships inherently bias us, okay? And in no way, shape, or form is that more relevant in sports medicine.
Sure.
Right? So making sure that he's not attached to the Blackhawks.
Right.
And so he has no stake in the game. He's not trying to rush you back.
Yeah.
He's going to try and optimize you and trying to get you better, however long that takes. That's how long it's going to take, I really want people to understand my next year is taking these doctors who've been on this international consensus committee. 30 out of the 40 have major relationships to collision sports. So year 2 is to go in and to highlight the names of these people and their relationships. These are where we're getting our information from, athletes and parents, about returning to play protocol for a sports concussion, which there's no such thing. Did you describe your concussion as a car accident concussion?
Yeah, I guess.
You said I got a concussion in car accidents.
Yeah.
You didn't, right? So sports concussion.
Yeah.
I got a concussion playing sports.
Right.
Mm-hmm.
Fall concussion. Your grandmother falls, gets a brain injury or concussion. Oh, honey, I got one of those fall concussions last week. No, nobody says that. So what is this term, sports concussion?
Yeah, SRC,
incredible.
sports-related concussion.
And
it's in that Berlin,
it's a brain injury,
consensus.
and they use
Consensus.
that. They use that because when you go to court, you're confused right now. I
Yeah.
can see it. I was confused for like a year and a half. John's probably confused. Guess
Always.
what? Guess what happens when it gets to juries?
Yeah. You confuse them to
Everybody's
death. Yeah.
confused.
Yeah.
Okay, so like my next year is like really delving into who neuropsychologists are and their role in industrial medicine back in like the 20s and 60s, getting workers in the mining industries back to work quicker. Sports medicine is an updated version of industrial medicine, and they don't have the athlete's best interest in mind. So when I say this, I want people. I've said this to you. He gets shit on all the time by medical professionals. There's snake oil. You get shit on because
listen,
he's not part of that international consensus group, and neither is Dr. Carrick.
Yeah,
you know,
this is not like George anatomy.
Yeah.
Okay, this is neuroanatomy. This is the stuff that the neurologists learn, the pediatricians learn, that everybody learned, and now they're getting into saying, okay, we're gonna refer them for vestibular rehab. The problem with, the vestibular rehab that other disciplines have learned is a weekend course. Okay, it's not a weekend course. Okay, it is like thousands of hours of work, and your brain really needs to know. It really needs to know just two things. Okay, it needs to know, number one, where you are in space. It needs to know where your hands are. It needs to know where your feet are. It needs to know where your organs are. It needs to know where every piece of body is on you, and it needs to know where space is around you. And the things that calculate that are your vision, your vestibular system, and your proprioceptive system. And if all the input that comes into your brain goes through the pupil into the back of the retina and then transposes onto this area of the back of the brainstem, which creates these maps in your brain. Okay, so if you're walking down the hall and you're bumping into stuff, okay, you're skewed. Something's going on. You're bumping into stuff. There's a skew there. It's because these maps are off a tiny bit, and so we're able to, before this gets worse, okay, we're able to kind of remap those areas of the brain, and make sure that you don't have a fall, or you're a hockey player and you don't see this guy coming like 12 1,000ths of a second before, and now you got another concussion, okay? But if you're able to expand, like what Daniel was talking about with your peripheral vision, and be able to decrease your latencies, increase your reaction time, be able to have better spatial awareness by doing these exercises, and not just go down this algorithmic, oh, you can do this, you can do this, you can do this, and then all of a sudden you don't have a concussion. Go back to work.
What would you like to see, maybe not even just the NHL, but collegiate and high school programs start to do for kids? Because by high school, most contact sports, and correct me if I'm wrong, Daniel, but in hockey in high school, they're pretty much hitting full blown.
Yeah, there was an article this week that came out that that's some of the most alarming injuries are happening in high school. Canadian high school and American high school. Kids are just not skilled enough in skating and balance, and it's getting vicious. So, rightfully so, coaches, parents are concerned, and they're thinking about actually taking hitting out of high school hockey, which I think would be a really good idea. I honestly do.
I think, to answer your question, I think the big thing is that the impact test that Daniel's talking about is it's not a bad test, okay, but it's a good test when you try 100% every single time you do it. So when Daniel was saying, you can game it, well, if you're, number one, if you get a concussion, well, first of all, a lot of these kids in high school, let's say they're football players, they have to take the impact test and they'll score whatever. It's like a video game for them. They want to get the best score they can get. So let's say for example, they score like an 80, okay, and they get a concussion, and the coach says, okay, how you feel? Goes, I feel pretty good. Well, you got to retake that test and got to get an 80 or better, okay? Well, if he gets a 70, he can't play. Now the kid says, I don't feel like I have any symptoms, and I feel like I can play. So now he's got to miss a game or two or three until he does his stuff and passes his test again. Well, next year, what he can do is he can go on. He's got to retake the test again because it's an every year thing. Next year, you can say he can go a little bit slower. So his score is now a 70. Okay, so now even with a concussion, okay, he can still pass this test, and because he was able to game it. The stuff that we do is objective. You cannot fake a reflex. Okay, if you do, you either are faking it, we caught you, number one, or number two, you got a brain tumor, you can't play anyway. Something's going on that's serious, where you cannot fake these eye movements, you can't fake these reflexes, you can't fake your balance. We're checking your balance and your coordination. Your every single corner of your brain is getting checked during this exam, and I think that and we also do a neurocognitive test. We do it through Cleveland Clinic, the C3 Logics it's called. And so once you combine all these things, now this is a comprehensive baseline test that checks and tests for brain functionality. And now we know where this kid is, okay? You can't really tell. The only research that's been done on impact, okay, has been by the company that owns it.
And
Okay,
the two doctors who have very,
no-
very, very strong relationships to the NFL.
Mm-hmm.
Just go look at who the two doctors are. And what I've learned is that my data, not mine. Guess who owns it?
NFL?
They do. No, those two doctors. They have all this data, right? There's millions, I think, or hundreds of thousands of kids using this.
Oh, yeah, millions.
So they have all this data. Usually, like, this data is like gold. They'd be mining it every year. Why haven't they? They haven't because the data is not good.
There's no retest reliability.
No, there's none.
That was an independent test. That was
And how
done,
could there
yeah.
be? So, like, when you're talking and you're saying, like, you can't game these. I'm a company. Do I want a sick employee or do I want a healthy employee?
Right.
Like, why wouldn't these teams be taking an approach where we want the healthiest hockey players to be able to perform the tasks we need them to perform at the best of their ability? Why would we want somebody who might be hindered in hand-eye coordination because their ocular system or vestibular system is off? Why would we want that?
I think they're coming around. I mean, some of the teams are really coming around. I mean, I've noticed that. No, some are just, they make a lot of money, they don't really care. But other teams that really want to win, and they really care for their employees. They're an asset. It's an asset of your company, and then you talk to some of the players or some of the even some of the junior players, right? And they say, well, look, if I get hurt, okay, there's another guy waiting to take my spot too.
Right.
So that's
you got to get back to play as quick as you can.
And so that's why they think that maybe the smaller leagues. Okay, I don't want to bash NHL, but the smaller leagues are.
Well, it's not bashing. We're just we're
these are
talking
facts.
about
I
a
mean,
reality, man.
yeah.
This is a reality. This
Yeah.
is a fact. It's a fact right now that there's no neurologist on the staff of the Chicago Blackhawks. It's a fact, right? And what happened with Corey Crawford this year? What's happened in the past?
Yeah.
These are facts.
Yeah.
These are all out public information. I mean, like it needs. Look at the history of the Blackhawks. Stan Mikita, Bob Probert, Steve Monador, Ray Emery, myself, Nick Boynton. They do not have a very good record treating human beings for brain injuries. It needs to change. It just does. And as long as I'm still living in this city, I'm going to try my best to highlight this, and I swear, it may come off negative to some people, but it's just, these are all facts. Just like what I talk about these doctors, they are all facts. They're facts because if they're not facts, there's a defamatory lawsuit coming my way. They're facts.
Well, I think what you're doing is incredible because there's probably a lot of people who have had certain feelings similar to yours when they're, either playing or retiring who just don't take the time and effort to obviously learn everything you've learned, because just sitting here talking to you, you sound like you've done 20 years of research on this topic, and it's you going through all of your own difficulties and being very candid about all the things that were difficult to you and your family, and then putting it out there, and I'm sure a lot of people are not happy about you putting it out there, but what you're going to do in turn is open a lot of people's eyes, not just athletes, but fans, to what you've gone through and what a lot of your peers are going through, because it is insane as a layperson to sit here and think that what you guys are saying that these large sports bodies should do is not being done. Because one, it's going to treat you guys more effectively, but two, it seems like with everything you're saying, doctor, the preventative part of it. I mean, if you just get the athletes to a space where they're just more optimal, like you guys are saying, and it's even a tenth of a second or a millisecond, and they avoid a concussion, well, then your athlete's not going to have a concussion. They don't have to sit out. They're healthier. Your team does better. So to me, it's insanity that, let's say, Daniel said that some doctors will, not believe that this is a real treatment or it's snake oil. It definitely can't hurt. Even if somebody thinks that it's not right or it's incorrect, even though we know from your experiences it works, what's the downfall of giving these athletes the treatment? It doesn't seem like there's a downfall.
Yeah, here's what we do at our clinic, okay? And normally I'm like, when I started really seeing concussions about 5-6 years ago, like a lot, I was the 30th, 20th, 40th doctor that they'd gone to, and they come in and the parents are pretty, the moms want to help their kids, the dads are pretty stoic on, what are you going to do? That the best neurologist, that we went to the best and the best and the best. And I go, well, what'd the best do for you? You guys are here now, right? So nothing's happened. So, and they'll say, they'll ask me, what kind of therapy do we do? And I say, well, we do vestibular rehabilitation. We did, it didn't work. And I said, well, what did you guys do? Did your son do this? Oh yeah, we did this exercise. My son's been doing that exercise for 6 months. I go, you know why your son's still sick? Because that's the wrong exercise. Okay, so there's a hierarchy of this is what's so unique and very specific for every single patient. Okay, you cannot give a canned treatment protocol for these patients. Okay, this exercise that I'm telling you, this is like me telling you, look, Mo, I want you to go lift 500 pounds right now. You say, well, I can't do it. I go, I want you to do it. This is the 500-pound exercise. You need to lift 5 pounds. We need to build from the foundation. It's like you're living in the penthouse and your foundation is crumbling. So when we do these therapies and these exercises, they seem so simplistic and so benign, but this is where we got to start. We got to start from a point where your nervous system is allowed to even accept some of this therapy, okay? And we'll try 1 or 2 or 3 things. If this patient, okay, we're going to get diagnostic objective findings and say, okay, today, your eye movements to the left are 1 out of 10. Your frontal lobe is functioning out of 3 out of 10. Your brainstem's a 2 out of 10. Your cerebellum on the left is a 1 out of 10. And 2 weeks later, we're going to repeat all these tests again. Okay, I just need 10 days. You've been suffering for 5 years. Give me 10 days, okay? And you're going to pick, you tell me what is the one thing, not that we're only going to treat one thing, but what is the one thing that you want? If I had a magic wand right now and I could get rid of one thing, what would it be? So I got these headaches that are 7 out of 10 every day, between 4 to 8 out of 10. I'll say, okay, look, our goal is to get you down to a 1 or a 2 out of 10 in the next 10 days, okay? You come back, and I'm going to show you objectively that every one of these objective biomarkers got better. You're going to see it with your own eyes. It's on video. So you can see it, and you say, yeah, doc, I see my eyes are better, this is better, my balance is better, my latencies are better, my hand-eye coordination is better, my headaches are still 8 out of 10. You know what we do? You X Dr. George off the list, and you're out, okay, because I can't help you. What we do works quickly. I'm not going to treat you for 3 months and say, well, Mo, that didn't work. Let's throw another dart over here and see if this works. It's just not, it's socially not responsible to do this. We are looking for, we don't want to treat kids with concussions. We don't want to treat NHLers with concussion. We don't want to treat anybody with it. We want to optimize their efficiency so they avoid getting these hits like what you were talking about all the time. And it's not that hard, okay? But you need to, somebody's got to take a step and say, okay, I want to see where am I at optimally.
Tell everybody, I tell everyone all the time, like concussions is a very small piece of
what we do,
of what you do. Yeah. Can you tell everybody what you treat? Can you run that gamut?
I mean,
because
our first day that you come in. First of all, the paperwork's we're trying to cut back on it, but it's about 18 to 20 pages long. The first day you come in is a 3-hour exam and diagnostic testing, okay? And some of these people are burnt out. But every exam and every diagnostic test is the same for almost every single patient. And we treat what we find. Now, if you're coming in, you could have Parkinson's, you could have, migraines, you can have concussion, you can have brain fog, cognitive decline, auto accidents. I'm an accountant, I can't add numbers now. We treat kids with ADD, ADHD. We treat a whole bunch of dysautonomia, which is huge, and a lot of people don't know what that is. But that's where that is like the foundation of the nervous system. That's the brakes and the gas of the nervous system. When you get this dysautonomia, and we have girls and boys that have concussions or get these viral infections, where they're sitting there, their resting heart rate's 150, 160 beats a minute. They're sitting. Okay, and they're wondering, I can't get out of bed. And then the school said, we think that they're faking it. They go to these big university hospitals and they say, you've got what's called a functional neurologic disorder, which is basically, it's a real thing, but we don't have an answer. So we're just going to label it this. So go find whatever it is, right?
And swipe your insurance card and take an MRI just for.
And the MRIs for concussions and stuff, like I said, unless you have a, subdural hematoma or skull fracture or some sort of, lesion that'll come up. Everything is physiologic. So we treat physiologic lesions. We don't treat ablative lesions where, anybody can throw up an MRI and say, oh, look at this walnut that's in there. That doesn't look like the other side, right? So
here's one of the scariest things that I've come to learn: learning disabilities. Imagine if your son or daughter is trying to go to school after a head injury, suffering from concentration issues, light sensitivity, short-term, long-term memory loss, slurred speech, processing problems. It's going to be next to impossible, fatigue, to learn.
Yeah,
sure.
So now you have your son or daughter who's missed a month of school, and school moves quickly. That's one of the biggest stats that I loved of the University of Cincinnati, is that their GPA, guess what?
Through the very high.
Has been the highest across NCAA sports for the last 6 years. Weird. Is this a coincidence? I don't think so.
No, it can't be.
I do not think so.
Look, if your eyes can't jump from word to word when you read, okay, then you're going to skip words and you're going to read a paragraph for 2 or 20 minutes. Go, geez, I just read for 20 minutes. I got to go back and read it again. And a lot of times that's tracking. That is just tracking the words. And if your eyes are jumping because you had a concussion and it was never like, you can look at me right now, but you have something to focus on. But if we put you in the dark and say, okay, Mo, I want you to keep your eyes open, which is a test we're going to do for you, and your eyes are just going boom, boom, and they're just moving, your brain gets confused. And it's exactly like, have you ever been in, the way I describe it to parents sometimes, because it's kind of hard for them to understand, is, have you ever been in a car where you're sitting there with your foot on the brake and it's a red light and you're just waiting for the red light to turn green, you got your foot on the brake, and this car next to you kind of starts sliding backwards and you slam your foot on the brake thinking you're moving? Okay, that's called a sensory mismatch. Okay,
Interesting.
You executed a motor output for no reason because your brain was confused. Okay, so now imagine that you have this problem, but you can see. Okay, you can see and you can focus on stuff. Well, you're doing this 24/7. You're moving, you're jiggling, you've got awkward balance. You're going to have a higher incidence of falls. You're going to have have tight neck muscle. If your eyes are moving, okay, your brain thinks that your head is moving. Okay, and if you're sitting there and your vestibular system's saying, he's not moving at all, he's just sitting there, nothing's happening. Your proprioceptive system says, he's sitting in the chair, he's not moving, but your eyes are kind of trying to stabilize this movement. Your brain says, hey, we think that Mo's falling. We need to stabilize his head on his body. The only way we can do it is tighten these neck muscles up. And then you go, oh, my neck's tight, my neck's sore, so what do? My neck's tight, my neck's sore. I go to a massage therapist. I go to a chiropractor. I'll go to a physical therapist. And what do you complain about? You complain about neck pain. You go get the massage, okay, you go get the manipulation, adjusted, whatever, and all of a sudden you feel pretty good. The next day your symptoms come back tenfold. Why? Because the compensatory mechanism, which was this tightening of these muscles, was released now. Okay, so now you're going back to you're going back to all your symptoms. And the reason that that happened is because it wasn't the neck that was the problem. It was your eyes that are the problem. And your eyes, we have to stabilize that gaze. If you can't gaze fixate or gaze stabilize, you're going to have a lot of trouble getting better for any problem, whether it's concussion or Parkinson's or Alzheimer's or I mean, these are all progressive neurodegenerative disorders, but and the only thing we can do for those really is you're going down that highway, 90 miles an hour, Parkinson's or dementia or Alzheimer's. Okay, the only thing we can do is slow it down a little bit. We can't reverse it. We can't really do, but there's stuff that you can do, and hopefully you can catch it at a much earlier date than when you're 65 and you go, man, I'm forgetting my children's names.
That's another big misnomer. I think there's a lot of people out there selling Alzheimer's, selling change your diet and stave it off. Doesn't exist. I talked to John Crary at Mount Sinai. He's a tauopathy expert. He looked at me in the eye. He said, "Go eat Burger King. Mm-hmm. If you're gonna get it, you're gonna get it."
Yeah.
There's literally nothing we can do right now. And neurodegenerative diseases run in my family. This is why I'm also so passionate about it, right? My grandmother passed. Her 2 sisters passed. Her brother passed. So they definitely run in my family. And if repetitive head trauma speeds that process up, I'm hoping it doesn't. But what I've been told by experts who I trust is if you are genetically made up to get it, you're going to get it.
Likely going to get it.
That's for me, I'm like, I want to hear that. Tell me the real stuff.
Yeah.
Don't
sugarcoat it to you.
No, don't tell me I could change my diet and I'm doing that. And tell me actually what's going on. Obviously, changing your diet. We know about the gut-brain axis. It's huge. A lot of people wake up with anxiety and they'll move through their whole day. Well, did you drink a bottle of water when you got up? Are you hydrated? Did you eat something?
What is your routine now? So, because you were an athlete for all of your life, and then you stopped it. What's your routine? Because I'm sure that probably was a tough stop for you too.
Yeah. In the beginning, I tried staying home and just trying to enjoy my kids, and it's just not enough. Yep. I'm a high operating individual, and I have been for a long time, and I have a busy mind. That's me. I was always a really good student, and so, but I always like to focus on 3 or 4 different things. I didn't play one sport. I played badminton. I did track and field. I did soccer. I did hockey. I did everything I could. And it's no different, especially, so you get up at 9 a.m., you're a hockey player for 12 years, you're ripping around the ice at 35 miles an hour, catching a pass, cross ice on your backhand, getting your head up, trying to beat a defenseman. You beat the defenseman, maybe if you're lucky, there's another guy that you're spotting, you make a decision, pass to him, don't pass to him, okay, now you got your head on the goalie, you're like, oh, is he going down, or are you going up? And all of this is happening in 2 seconds.
Yeah.
Poo, 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 poo. Firing, right? Your brain is firing. When that's not happening anymore, and then you compound that with you lose the community, so you can't talk to anybody about it. It's just difficult. I turned to substances to numb it out, and then when I was ready to finally face it, you implement things in your life that you believe in, and I believe in this foundation. I believe in educating people through an informal process, and I believe in some other things that I haven't told people, and I'm not going to tell anybody until they're done. Yeah. Because you got to protect yourself. You really do. As a former athlete, when you're not in that community anymore, you got to move through this world a little more cautiously than others, and you also have to be really educated. I've made it a point to read a lot. I write, which is wonderful for me. Writing a book and selling something to Netflix now, and I just did a couple episodes at the Players Tribune on talking to different athletes about what concussions are, and let's humanize this thing. And what were your symptoms? Oh, really? They're the same as the car accident concussion. So people can start connecting these dots.
I was going to say, you put it in layman's terms really well, and you've explained, even for this hour and a half we've been on, your struggles so well. I was going to say you should write a book on this, but it sounds like you're
Yeah, I mean,
you're
it's
on your way
something
to
that
do that.
Yeah, it's something I want to do so that, you can just reference.
Yeah.
Oh, it's like, you're a hypocrite. No, I'm not. Go buy my book.
Yeah.
You can get to know who I am.
Yeah.
I don't believe in not having collision sports. I think collision sports are.
They're going to stay.
I think they need to.
Yeah.
What are you going to replace head trauma with cardiovascular disease? So. But there's things to do to make sure that when that kid, because he's a kid, he's 18, signs on the dotted line, he needs to understand the risks of doing his job. Just like somebody that worked with asbestos,
Yeah.
Or works in a chemical plant. Here are the chemicals you're working with. Here are the risks. If you want to monetize that, go ahead. That's the decision that they took out of my hands.
Right.
And that's where the frustration some days comes from, but that's also where the intensity comes from.
Sure.
Because they're still not getting that education, right? So until that happens, then you want to monetize that, put some protocols in, to make teams, like individually teams, more attractive to superstar players. Oh, we're going to take care of you. Come to our team. Man, that'd be a big sell for me. Where do I want to sign next year?
Yeah.
There's so many things to be done,
It's almost like not only are they not educating it, it's almost they're blinding people to it. They're purposely almost blinding it. So it's not even just, it's a step, I think, more negligent than non-education, at least until recently, when more and more people like you and Dr. George are coming out and talking about this stuff. It was a blinding effect, not so much even a lack of education.
So I just did a brain damage timeline read, and I'm going to put that out on my YouTube channel, but I think I might get the year wrong, but the first time CT was introduced into the medical literature was 1933 or 1943. And all the way up, it was known as punch drunk, dementia pugilistica, like we know about this stuff. Then all of a sudden, 1989 to 2003, the height of the NFL and the NHL's popularity, no more studies. Nothing.
Crazy.
There's a big gap. You start digging in, man. I implore people to know where you are getting your information from. You have to know where you're getting your information from. You got to know that, wow, the NFL and the NHL actually went outside of North America to appoint somebody, the head of their, head, neck, and spine committee and consensus group. Why'd they do that? Harder to find a doctor who's running that in Australia than it is here in North America.
Sure.
There's reasons why they took steps. There's reasons why the NHLPA and the NHL withheld the actual term dementia off of a poster that was supposed to be in all the rinks. You got to give the guys the right information, even so that I could stop doing this, so I could move on.
Yeah.
Please help me out, So, and when that happens, then can't do this anymore.
Yep.
Now they know the information. They signed on the dotted line. They're getting some pretty decent care, and if they're not, I'm confident that they can go elsewhere to get it in the summers when their contracts are over. I've sent over 30 or 40 guys to certain clinics because when you're not under the care and you're not under contract, you can go wherever you want. When you're in the season or playoffs, you cannot.
And hopefully the insurance is covered. Doctor, what got you into, because you said you've been a neurologist for a long time, or a chiropractor for a long time. What got you into chiropractic neurology?
So it's a pretty interesting story. When we moved into a new building, and so I'd start getting a whole bunch of mail. And so one of the flyers that I received was it said, "Do you want to treat like migraines and ADD and ADHD, tics, Tourette's?" And my daughter had Tourette's. And so I look at this thing and go, wait a second. We'd gone through to the pediatrician and said she had some like neck tics that she had, and so the pediatrician sent us to a psychiatrist. And the psychiatrist said, we want to put her on the smallest dose of this anti-schizophrenic drug. I go, what? I go, that's crazy. But my wife said, we got to do something. So we ended up putting her on for one day. She came down the next day, and she was like just like awful. And she goes, I'd rather have the tics than take this medication. So we took her off. And then so I called this guy up, and he was a chiropractic neurologist up in Wisconsin. I said, hey, man, I go, what's this all about? He goes, well, no, I can teach you how to do this stuff, blah, 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 this, that, and the other. And so I ended up buying his program. Okay, it was like $4,000. And he says, this is what I'm going to do for you. You're going to buy the program. You're going to do the whole thing. And if you don't like it for the next 6 months, just return it. I'll give you all your money back. And so I bought it just to treat my daughter, find out what this was all about. Anyway, I learned this program inside out. It was like just a manual or something. So I called the guy up 5 weeks later. I said, hey, I can teach this class. What do I do now? He goes, what do you mean? What do you do? And I said, you know, what do I do? What's the next step? He said, what do you want to treat? I said, how about migraines? I'll treat migraines because that's like I used to refer all my migraines out because it was like hit or miss for me. And so he said, okay, I want you to go pick 5 migraine patients that you'd sent out, and I promise you they still have migraines. And so I picked out a couple of hard ones, but there's one lady in particular. She had migraines 27 years, 20 days a month in bed. Okay, she couldn't get out of bed for 20 days a month.
Ruined
and
life.
So anyway, I called her up. I said, hey, Barb, I want you to come in. I'm going to treat you for free for the next 2 weeks. Just come on. I need to see if this works. So by about the 11th day, she was like complaining about knee pain. She goes, when are you going to fix my knee? She goes, well, Barb, how's your migraines? She goes, oh, they're gone. But 27 days, 27 years are totally gone. So then I called the guy up. I go, holy mackerel, dude, this thing is really for legit. He goes, look, what I've got here is like nothing. He goes, this is baby food. He goes, if you really want to learn this stuff, he goes, you have to call the Carrick. You got to get a hold of Ted Carrick. I go, who's Ted Carrick? And he said, you know, he's like the father of chiropractic neurology. He goes, call him, start taking the course now. That was 2008. I have not been home, okay, like no joke, every month for the last 11 years. I've been out of town learning this stuff.
That's incredible.
And we treated my daughter. My daughter's like 95% better. Actually, I will give a shout out to Dr. Mark Ellis, who's huge. He treated my daughter in Atlanta because her tics got so bad, and I was like all freaked out. And he treated her in 45 minutes, basically eliminated her Tourette's.
And that's the
Yeah.
thing too. Like
45 minutes.
We talk like this,
Yeah.
you know, and like
And people
that's
go,
where
what?
some people are like, it's bullshit. It's
Yeah.
a-
This is
like,
legit,
it's-
dude. This
yeah,
is I saw it with
it's-
my own
I mean-
eyes. Okay, if I hadn't, I
Your own
videotaped
daughter, too.
with my own daughter. I
Yeah.
took her. She had gone to Greece. Okay, she was a U of I student, and she had these. She ended up getting when she was under stress doing some finals. Her tics ended up going from a motor tic to a vocal tic where she'd hiccup, and her hiccups were like one every 2 seconds. She'd just go every 2 seconds. So when she was done her finals, she ended up going to Greece for 10 days. By the time, and I was given some glasses that some guy told me to have her wear. And I said, okay, you can go, but you got to wear these glasses with these lights flashing and so on and so forth. Anyway, so I gave her the glasses. By the time she landed in Europe, her tics were 120 tics a minute.
Oh, geez.
Hiccups, right? So now my wife's freaked out. My daughters are all freaked out. You got to call Carrick. You got to get him. She's got to see Carrick. And so anyway, so Trish Carrick, she said, well, my dad's in France. Go see Mark Ellis, this guy. And so she flew back 10 days later from Chicago, went the next day to Atlanta. 45 minutes after that first appointment. I mean, he did exactly what we do now, but he did it in 8-9 years ago. Done. I mean, totally gone in 45 minutes. She was reading, no hiccups, no movements, no nothing.
And
Yeah,
Mark in May, when I was down at ISCN, he showed me a 10-week study of reversing the signs of early onset dementia through this same protocol.
Yeah.
It was a male, and he was instructed to write a clock. I've got the 3 pictures on my phone. You could barely get a circle there, and I think he maybe got 1 dot in there, and then the 1, 2, 3, no hands or anything. And then after, I think it was 6 weeks of treatment, he went back and tried to draw a clock again. So he did the same thing: circle 1, 2, 3, 4, 5, 6, small dot in the middle, big hand. Right, so he's still missing the little hand and 6 other numbers. At the end of 10 weeks, he drew a full clock. So like, and there's research out there that
it sounds pretty small.
Yeah,
it's gargantuan.
It's huge.
Yeah, it's huge.
And it's like we're talking about miracles, and I don't talk about the miracles, right? I try to like stay on point because it's hard enough for people to understand. But one of the miracles of like why I'm on this path, you just heard about why he's on this path, was Steve, and Steve introduced me, and then Steve's death, and then seeing the deterioration firsthand, and then almost dying from the same thing. And I can't move forward in life without trying to get as many people into, professionals like Dr. George, not only because of the work that they do, but because there's a lot of other people that are selling snake oil, right, that claim to know this stuff and they don't. So it's always Carrick trained. And you have a chance at getting better. And first time I went to Atlanta at the Carrick Institute, I watched, there was a waiting room, so there was about 20 people, and you kind of move through. It's like a bit of a carousel, and you're at stations. And there was a lady there who was in a wheelchair. She'd been there for almost, I want to say like 2 or 3 months. Mm-hmm. Took a few steps that, the Monday or Tuesday, and she's starting to come around. And a lot of these people have been there. I was only there for 5 days, but a lot of these people have been there for some of them months, like talking to each other every day as their loved ones going through the protocols. And a few steps on the Monday, a few more steps on the Tuesday, more steps on the Wednesday. By Friday, she's walking back and forth to and from her wheelchair. She said she hadn't walked in 47 years.
Wow.
The whole waiting room's bawling their eyes out. I'm looking around. I'm like, what?
That's pretty incredible.
It's, what is this? It's amazing, and when you understand it in lay's terms, or when you try to, digest it, and George explains it really well. It's easy. It's easy stuff, like just dive into it's got to be a book for dummies, just like what your brain operates, seriously.
And it's such a complex thing, your brain. My dad's a cardiologist. He always says this. He goes, a heart is a relatively simple thing. He goes, a brain is a very complex thing. You as a professional athlete, you train so much of your body, from cardiovascular to, your legs, your speed, and so many different things. And so few people think you can train your brain and then help it recover too when it needs it. It's fascinating.
The amazing thing is that the heart is a predictor of brain health. So with heart rate variability, right? So you need that variability because every time the heart pumps, right? It's not, if it's 60 beats a minute, it's not pumping every 1 second. It's pumping 0.9, 0.98, 1.07, 0.93. So there's variability, and this tells you the integrity of that autonomic nervous system. So if you're beating every 1 second, boom, 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 you're flatline. You're ready to die, and this is an early predictor of brain disease. So.
As he's talking right now, I'm thinking in my head, I'm like, man, I basically lived, I think, the last 13 or 14 years with my autonomic system totally off.
That's tough.
Because the job we do too, right? Think about the Sudafeds, the uppers, the Red Bulls, and then the downers.
Pre-workouts.
It's just
sleep meds.
It's a roller coaster. You get home at 11:30 and you're not hungry. You're sweating uncontrollably. You're supposed to go to sleep, but you're still wired, stimulated, overstimulated, and that cycle continues every other day for 185 days, and then in the playoffs, and then you get 2 months off, and you repeat it. So, just listening to you talk, I'm like, man, and because I had a big problem with my autonomic system. Mm-hmm. Some days I still do, where I sweat, for no reason, and where my heart's racing for no reason, right? And so these are indicators now that I know that, like my speech today, hearing it in these headphones, I got to get back. I got to get back on it,
Well, you have a lot of fans, Doctor, because you have Best Doctor Ever from Thammy Remke. Kathy's commenting again. You got Carly saying George smiley face. You got a lot of fans here. I think you've cured probably.
I owe them each $5, I think.
Yeah, I think they owe you 10.
They owe you a testimonial.
Yeah.
Yeah. Right.
So that you could get this information to more people. That's all.
So if somebody wants to come and see you, just call the office and schedule. And you said the first one's a 3-hour.
3-hour exam, yeah. So they'll be there for a while, and so should I give my number out?
Yeah, sure.
Yeah, sure.
Yeah.
So we're in Wooddale, Illinois, Neurologic Wellness Institute, 630-766-1552.
And we'll put that in the comment section as well so people can give you guys a buzz, because I agree. I mean, obviously for people who've had some sort of head trauma or are professional athletes in combat or contact sports, you're doing incredible stuff. But like Daniel was saying, it could be for anybody. It could be for me,
everybody.
for
For
anybody who's got any sort of ailment or wants to
enhancement,
wants to
Enhancement.
perform at the top of their
Talk
ability.
about like police officers,
yeah, huge.
right? There's a lot of head trauma, repetitive head trauma in police work. These people are shooting guns through a sight line. Their vestibular system, ocular system's off. Pretty serious,
Yeah.
you know. So I talk a lot about firefighters, military veterans,
say
women
my-
of domestic violence, child abuse victims. I mean, you run the gamut, and that's just head trauma, right? So
I've had a handful of race car drivers, boxers, jiu-jitsu guys watching on. For those guys, 100%. I mean, I think now back, and I do jiu-jitsu, but boxing I don't do very much of. But race car driving, you got so much movement from your hands to your feet to everything, and
depth
there's a bunch of
perception,
depth perception.
speed,
Yeah.
it's
Hand-eye coordination.
Hand-eye
the
coordination.
F1 guys are like, that's where I looked
They're
to.
optimal athletes
Oh, they're
now,
optimized. That's where I looked to when I was doing like the hand-eye drills. I looked to the F1 and Indy to get what they were doing,
Yeah.
because they're implementing some pretty amazing stuff with like the D2 and fit light systems. So it's there's information coming out every day. Like I said, every week there's new studies, and so for
At least
people
that's
that,
optimistic. At
yeah,
least,
for sure, and
Yeah.
from the right people too, right? And evidence based. There's a lot of evidence based data on this very thing that we're talking about. A lot of medical papers written and reviewed. So I would just implore
everything we
people,
do,
to look
everything
at
we
it.
do is evidence based, right? It's not
Yeah.
like we make it up. This is like in PubMed. Okay, it's a simple search. You can get it. It's easy, and
And I'm
That's
the,
good
you
stuff.
know, I don't work for the Carrick Institute.
Yeah.
I don't have any monetized relationships, and for year 2 of my program, there's a reason for that. And I'm just a guy who's been seriously impacted by this treatment.
Yeah, they've changed
by
your
what
life.
they do. They've saved my life, no doubt. I wouldn't be here.
What's your favorite NHL moment? Shifting gears a little bit. Which one?
I think like making the playlists.
Yeah.
Like that stressed me out more than the games, to be honest.
Really?
Yeah, well, you're trying to appease like Sharpie with Pearl Jam, or Crawford with the beats, the heavy beats, and Johnny with some country or Audio Slave type of stuff. And he really liked Arcade Fire, but you just want to you get a certain amount of allotted time, and I really liked interacting. I think I had such a difficult time with transition because
Camaraderie is gone.
I loved the community. It wasn't so much about hockey for me as it was about doing something together and working towards like a goal, and we're all on the same page. And I had a role in that, however small, however big. It was a role, and sometimes it was just playing the music. I wasn't even in the lineup, and I tried to excel at it. I tried to make everybody happy and take that stress away from these guys who are in a big city making a lot of money, and music is one of the tools that I use too. And when I'm having a bad day, I got a lot of vinyl, and I put on vinyl, or I put on my headphones and I go cut the grass, or I try to do something that keeps me in the moment. When you're having those thoughts of, wait, what in 10 years? Like, no, come back, stay in the moment. Don't let your mind race off, and try to enjoy my kids. But yeah, man, I do miss those guys, and I have somewhat alienated myself from that organization. So it's, but I still hang out with those guys. I just don't I don't get invited to the convention or anything like that anymore.
Well, I think you're doing it for a much, much bigger, greater good than going to the convention. What you're doing is probably going to open the eyes of so many people. It's opened my eyes. I'm sure it's opened John's, anybody who's listening. But I would tell anybody, go watch that video on your foundation's page. It's one of the most powerful things I've ever seen. And I think what you're doing, Dr. George is doing, really has to have a bigger platform. And I love that you're doing it because you have a big platform. But athletes currently playing, I know for them it's a little bit more difficult to speak out, but any athletes not playing anymore, they got to get behind this sort of thing.
Yeah, I mean, I would say, like, speaking to, if there's any men or even women out there that are, sitting on their couch, suffering, experiencing these types of symptoms, anxiety, depression, suicidal ideation, headaches, migraines, head pressure, difficulty concentrating, fatigue, insomnia, oversleeping, light sensitivity, the slurred speech. If you're having any feeling off, feeling foggy, not yourself, look up what chiropractic neurology is, and look up the Carrick Institute and go on their website and check in their state, or just hit me up on Twitter, and I have a list of the guys that you can be referred to, and don't wait. Try not to wait. And like in my situation, when my quality of life got bad enough that I went and kind of seeked out help. Right. So try to empty that cup, and so you could be healthy enough to be present for your wife and your kids and your job and whatever you're trying to aspire to. It's really hard to do it sick, it's almost impossible.
I always say you got only one life to live. Try to live the best life you can. And I just, even myself, I would have never thought to go to somebody like Dr. George until today's conversation. And it doesn't make sense for anybody not to go be able to do that, because as simple as not having good balance, or as simple as what we were just talking about with your heart rate, not knowing that stuff to me seems like a completely silly thing, setting aside, of course, an athlete should be coming to see guys like you.
Yeah, I mean, I tried to ask as many questions as I could, like when he was doing the exercises, like, what is this? Why are you doing that?
That's going to be me too, by the way.
Oh, yeah, it annoyed.
Here's the thing,
probably
too,
annoyed him, but
No,
I needed to, because
it keeps us on our toes too.
Yeah,
and you know what?
For me,
So
as an athlete, like when I was with my trainer, I was, well, why am I doing this, Jimmy? Why am I doing these squats? Well, it's going to help with your, you just always, for me, I needed to understand it, because then I would do it to the best of my ability. If I didn't understand it, I was kind of fluffy with it, and he was great with the communication aspect of it.
I think the big thing is, too, that 5 years ago was a totally different platform than it is today. And 5 years from now, we're collecting research and data at our clinic, too, to publish. But 5 years from now, we'll be talking about other stuff and more advances. So it's rapidly progressing. And the whole key is a call for research, too. Everybody's got like our guys, the fellows and the functional neurology and chiropractic neurologists need to get on the same page and share data and publish it and say, hey, look, man, this is legit.
And on the terms, too, maybe. We can all come together on, Is there a regulating body? There's
for what?
Just like
chiropractic neurology?
Just for anything. For like brain
there's
injuries. Like who regulates, it's like we don't grade concussions anymore. We grade traumatic brain injuries, right? Like, who makes that decision? Is it still those 40 doctors?
Pretty much.
Yeah.
Well, I mean, maybe not those 40, but
somebody else.
Yeah. So I mean, there's got to be a grading. Everyone has to talk the same language, right?
Exactly.
So we have to know, and Dr. Carrick really harps on this too. He says, look, if you're going to be in this game, you better know what the language is, right? So we're all trying to speak the same language. So if I'm talking to an MD or I'm talking to a physical therapist or somebody, we all have to be speaking the same language, and because this is a big platform.
It's huge. I mean, that's one of the reasons, like, why I haven't said a word until really only a year ago. So it's like 2.5, almost 3 years of research, and then you can start talking about it. Because one wrong thing, like one of the things that I really had to research what the differences were between a concussion, a traumatic brain injury, and CT. I wanted to know the difference. Like, do you know what a concussion is?
No, not really.
It's a list of symptoms that are derived from the actual event, which is the traumatic brain injury, the actual shearing of your white and gray matter, accelerating, decelerating of your brain.
Yeah, I think
CT is just a neurodegenerative. Yeah, and so just explaining those two terms, I think, is useful. And then how do I know if I have a concussion? If the symptoms last longer than...
I think the big thing is, too, that, everyone needs to get checked. You know, whether you have symptoms or don't have, whether if you're already something's going on, you should get
Brain
check
health.
and see. Yeah, brain health. Check these biomarkers. There's biomarkers there that we can affect and make better, right? So whether it's we can go from the tip of your fingers to the spinal cord to the cerebellum to the brainstem to the cortex back down to the brainstem, and these pathways, they're there, right? We didn't make this is neuroanatomy. Like I said, it's not George anatomy, right? So this is the same stuff, and so all we have to do, it's almost like you have two 4-lane highways coming up both sides of your body. You want to make sure they're going 100 miles an hour, right?
Right.
But if one is going 100 and the other side's going 60 and it's only 2 lanes, it's got 4 potholes on the way there, this is the side we have to fix. We got to pave the we got to fill in the potholes, we got to make that lane wider, make sure that both sides are firing appropriately, and you can see this quickly. There's things that you can do objectively and with evidence-based therapeutic activities and exercises to get these patients better.
I'm mad at myself for not knowing more about it because I feel like I read a lot, but you go and you get a physical once every year, 2 years. For me to keep my racing license, it's every 2 years, and you just go get a physical and you do the eye chart, the 20/20 eye chart, and you do a few other things, and they're like, okay, here you go. You're good to go drive a car at 180 miles an hour, and best of luck. People should be getting your sort of checkup consistently, not just a physical. I'm not saying don't go get a physical, everybody. There are a couple doctors that are watching too. They're probably going to tell me, what are you talking about? But why aren't you doing both is I guess my question. People should.
Yeah, especially now that it's
Especially now when everybody's like this.
Yeah. Yeah, you're right. Everybody does just kind of stare at it. I mean, I'm guilty of it. In
am
front of me,
too,
I have
yeah.
an iPad and I have a phone. And
I'm just lucky that, without even knowing it, me and my trainer were training my hand-eye and my peripherals, and try to limit screen time. But you can look at this. This isn't, for me, it's an encyclopedia, and so I am on it a lot. I think just growing up, if we're centered on just here, right, and always here, like, right, what about over here? We're seeing all these accidental hits. I'm just, trying to make these connections and assumptions to, why we need it. And the kid's always on his phone and he's driving.
it's true. Might not be seeing what's coming.
Might not be safe, right? And so, if you want your kid to be sharper in school and a better memory and processing speed and concentration, why not do it? So there's a lot of benefits. I think with the University of Cincinnati and with the data that Joe Clark has on the GPAs and cutting the concussion rate in football by 80%. He also does it with the basketball, baseball, and soccer teams there. They don't have a hockey team, and it's sports specific.
Sure.
So you don't have like a right O lineman training here.
Yeah.
It's not a left O lineman. Where's he blocking? Here. So he has the guys on the back of the D2 board training here, hitting the lights in their peripherals. So
it's a big deal.
Yeah, it's sports specific, and it's
And like he
it's
says,
really
evidence
super-
based.
Yeah.
There's
buddy,
evidence that it's working.
His numbers are crazy. His concussion numbers are crazy, and then his sport performance numbers are off the charts because a couple coaches came in that 9-year period and pulled it from baseball and pulled it from football. What do you think happened for 1 year? All the concussions went back.
Yeah.
Back to 10 a year, which is the average in the NCAA. Baseball, just real quickly, when it was first implemented, the year before, they had 12 on-field collisions, and they were 31st in the nation in hitting. They went to 2 on-field collisions the next year to 2nd in the nation in hitting.
Wow.
Hand-eye, coordination, picking this up, reaction time, processing speed, sharp. Coach came in 2 years later. No, doesn't do anything. What do you think happened?
Batting average.
Batting average right back up.
Yeah.
Collisions back up. So
I just don't know how it does it, how it can hurt. It can only help.
No.
We're just sitting here as a layperson. It's not going to do anything but better you in some capacity. So for them not to implement it, to me, just seems like a absolutely insane
we have
thing.
muscles, right? We have 6 different muscles in our eyes. There's actually one called the oblique.
Yep.
Just like
In your eye?
Yeah, just like the obliques.
Two obliques.
Yeah.
Hopefully my eye obliques are better than my
Yeah,
my stomach
that's what I'm
obliques.
saying. You know?
We'll find out.
I didn't know that, you know. And then when I heard that, I'm like, makes sense, you know.
I'll have really,
But like,
really good eye obliques, and that'll be my Tinder profile. On obliques.
come check
Hey,
out my eye
ladies.
obliques.
Yeah, come check out my obliques.
But when you're not using muscles, what happens?
The weekend.
Weak.
You lose them.
Yeah, lose them.
Yep.
You know, like I went to like part of my functional baseline last week with Joe and the optometrist is that I have a really pronounced forehead and my eyebrows, and the top of my eyes are actually thinning. The lining of my eyes are thinning, and they think it's because of anatomy. And then also, I'm not a basketball player, and I wasn't doing everything from down here or up here. Excuse me. I'm here and I'm down.
looking
I'm
down.
here and
Yeah.
I'm down, and I'm here and I'm down. So I never used this.
Interesting.
So they think it's one, anatomy, and then two, the sport that I played.
I also
And
wonder if people now are going to have that because they just always look down.
There you go.
Yeah.
And then I'm going to bring him some other hockey players because he's never seen that before, and he's really interested to see if that's common with us, you know. So like these are the types of things that are happening with universities, and Joe Clark will train anybody that goes there. He's in education, you know. He's independent. That's the best thing, man.
Yeah.
He's independent from the University of Cincinnati.
So nobody can tell him he can or can't.
Nope. And
Very
three people have to either yay or nay somebody coming back from concussion. Two of them work for the university. Joe does not.
That's really
That's
good to hear.
that's the special sauce, you know, like having somebody independent
Right. Who's
from
not
these teams who
financially-
has, but you know, these leagues don't want that. Not right now, anyway. Hopefully, we'll see that. You know, because if the Blackhawks can implement like the GGT test that was created by a strength and conditioning coach and an athletic trainer or therapist, and I have to physically go through that test to pass it for them to clear me to play, that's not a league-wide test. That was specific to the Blackhawks. So if they can implement something like that, then they can damn well implement something better,
Sure.
right? Something better, a functional baseline, multimodal approach. You know, so team to team now you have to start holding teams accountable. You know, like specifically teams, and maybe not so much the NHL. You know, maybe it isn't their problem to do it. Maybe it is the teams within their organization. You know?
Well, if the teams implement it and those players start to do better and they're healthier, then
And you track the data just like the University of Cincinnati did. Guess what everybody's going to be doing? They're going to hop on
they're all
board.
gonna do it.
As
They're
soon
gonna
as the
have to.
Blackhawks do it, they're going to hop. Everybody else does it. As soon as the Leafs do something, everybody else does it. That's just the way that league is.
Yeah.
You know, you don't want to be left behind.
John, you got a question? You're pointing at me.
Yeah,
I
actually,
saw you
have
out
a
of my
few.
peripheral.
Oh, nice.
like
Perez,
that?
he's
I
training
do.
them.
Very good. Well, one of the questions I have is asked by a viewer, and he wants to know, as far as concussions and if there is a correlation with PTSD. Now, I know what PTSD is, but I don't know the ins and outs, and if they hold hands at all. So, I both of you, please weigh
I mean,
in.
there's like in the military, there's a lot like those high impact blasts that you know, those what do they call those IEDs that blow up. Those are a different type of blast injuries can cause a lot of PTSD, and this is very common. But there is definitely a correlation for sure. Yeah,
So,
there's a lot of
yeah.
research on that.
And whoever asked that question, I implore you to go to Joe Rogan Experience. Look up the episode 1056 with Andrew Marr and Mark Gordon. I just sent my blood to Mark Gordon. He's an endocrinologist who specializes in looking at veterans for TBI. I want to check my hormones.
Mm-hmm.
Nobody's ever mentioned that to me,
Yeah.
to check your hormones in your pituitary gland.
Yeah, I mean, this is where the
You know?
torsional impact, a lot of these torsional impact, that pituitary stalk is gonna, even a car accident, whatever, it doesn't matter what it is, you're gonna affect that hormonal
And
imbalance.
what does your pituitary gland regulate?
everything pretty much? Yeah.
So if
Hormones.
that's off, there's a whole bunch of other things that are off. Low testosterone is pretty common in what he's found with. Mm-hmm. He's treated over 2,000 TBI war veterans.
Mm-hmm.
Wow.
And with some stuff like simple shots of natural testosterone, he's gotten
results.
He's gotten some pretty amazing results. So
Fantastic.
I listen to that
we do a lot.
podcast.
Yeah,
and
we listen to Joe a lot.
Yeah, he's great. And so I immediately called up Mark, and for me, I wasn't, I'm not a veteran, and I will say it's not cheap, but I want to learn from as many of the experts as I can.
Sure.
And that's one of the things that makes a lot of sense to me, is to check. Even though building new neurological pathways saved my life, which is functional neurology, man, you should check your hormones.
Yeah.
if you have a history of repetitive head trauma, just straight up.
Secondly, this is more for you, Daniel. So the foundation, several points during the show, I put up the graphic with the website address. So can we just get a real quick overview? Are there events? Are there things that we can do to help support, buy tickets? Do you put things together like that? Are those in the works? Anything along those lines that we can talk about the foundation?
Yeah, that's coming. Right now, it's just it's a landing page. We're working in behind the scenes with a consulting company to basically put in a new board of directors and all of the good stuff that comes with a 501c3 and a not-for-profit. I am thinking about doing something in the spring, summer, an event. I was thinking about a walk, but I'm going to coordinate that. I'm going to do something here in Chicago and also do something in Toronto, and then land in front of the NHLPA offices for some interviews. And but yeah, I'll keep everybody posted on that.
Cool.
And, follow me on Twitter and on Instagram for updates about Chapter 5. But yeah, we raised a lot of really good money in when I donated my Stanley Cup Day. And I stayed here, and all of that went to starting Chapter 5.
Oh, wow. Okay.
And so, yeah, we will be having more events in the future, for sure.
Okay.
And definitely for anybody, and we've gone pretty long, I want to be respectful of both your times. I really appreciate the two of you guys coming in here and talking about this. I'm fascinated by it now. I've learned a lot, I think, in 2 hours. And Daniel, to you, I know you probably won't consider yourself this as an expert, but you've learned so much. What you're doing is such a big move in the right direction for athletes, especially who are dealing with some of the things that you dealt with both during your career and after. So kudos to you. And, I have a lot of my friends who've boxed and done MMA and stuff, and I think what you're doing affects so many different sports, NHL, NFL. We spoke about soccer. I never thought about soccer, brain trauma from soccer balls, but appreciate that. That's a big, big thing you're doing.
Thanks, man. Yeah, I appreciate it. And like females too.
Yeah.
There needs to be more studies done on females, because female anatomy is totally different, right? And the strength of their neck muscles makes them more susceptible to head trauma.
Yeah.
So, I just want to throw that out there. That Pink Concussions is a really great organization to follow on Twitter, and she's helped me out a lot, like with the differences of domestic violence, abuse, and females in sport and female brain injury victims specifically.
Yeah, a lot of them do play some of the similar sports, from boxing to MMA now, hockey, football. And yeah, it's crazy to think that their anatomy would be anything similar to ours. Very different. Yeah. And I know Dr. George was saying my anatomy as a guy to Daniel's might be completely different, and how we'd get treated would be very different. And then especially if you add John in the mix, it's all different. And
everyone's different.
Doctor, you're very well loved, because we got another. We love Dr. George. He's the bomb. Congrats, cousin. I'm guessing that's your cousin because of the Greek last name, John.
John, okay.
Yeah. So thank you to you both for taking the time to come on today.
Thanks for
Doctor,
having us.
I'm going to see you soon.
Yeah.
I definitely want to come get checked out. And Daniel, whatever we can do to help, happy to help. Excited to keep following what you're doing on social media, and whether it's a walk, a run, or an event, let us know. We'd love to be a part of it.
Well, appreciate it. Appreciate you guys having me on.
We really
Absolutely.
appreciate you guys coming on.
Yeah, sure.
John, what do we got coming up?
Well, let's take a look at what we've got coming up. So, everybody knows that next Tuesday is the mayoral election between Lori and Tony. So, while the campaigns were going on, one person, Gary McCarthy, came in, sat down with us for an hour and a half, talked about just about anything we threw his way and answered a lot of questions and such. And so I reached out to him and I simply said, listen, I know that you're not a lifelong politician. I'd like to know your take now that you've been in the mayoral race. I want to get a glimpse of the politics of politics in Chicago and see what you can share with us as far as from your run for mayor and things you learned, things that surprised you. And so we're going to do Monday night, 7:30, the night before the election. We're going to do a sit down with Gary McCarthy, prime time, and talk to him, but more listen to him about the things that he learned as he was going through the whole mayoral campaign situation. And he may want to share some stories about Lori and Tony. He may not want to. I don't know. It's his comfort level. But that's what we have coming up. Cool. We have another great show on Wednesday. We'll announce those guests Monday night. But for right now, Monday night's our first time we're doing prime time. Looking forward to that. 7:30 p.m. We're going to be right back here on Facebook Live with Gary McCarthy.
Very cool. Yeah, thank you to Gary for obviously coming on that last time when he was running and then giving us some time again to come chat with us. He's a pretty cool dude, and happy to hear from him again.
Absolutely. I'm looking forward to it very much.
Well, this was a lot of fun. Again, thank you to today's guests. That was not just informative, it was interesting and very cool to learn about.
Absolutely.
The wheels are spinning. I like to read too, so I'm going to go home and probably turn my iPad on, even though I'm not supposed to stare at it that much, and just read away because I'm fascinated now. So thank you guys for coming on, and I guess we'll see you guys Monday at 7:30 instead of just Wednesday at 3.
Yep, we've got. We're still going to have a show on Wednesday at 3.
Yep,
I want to make sure everybody knows that.
Monday at 7:30 next.
Yep.
Thanks, everybody.
In 3, 2, 1.